Howdy, folks. Welcome to Wellness Wednesday. My name is Kenneth Thomas, and on Wednesdays, I talk about various topics that have to do with wellness. So, for those of you who are joining me, welcome. Glad to see y'all here, and kind of getting to where I'm actually enjoying this. I realized that I may have bit off a little bit more than I thought. With going live 5 days a week, wanting to make sure that I have content for you and that I'm bringing things of value to you. So speaking on that, if you are if you are somebody who would like to hear some different topics on wellness, please drop me a comment down below. Let me know what kind of topics that you'd like to have covered. And if you're watching this on live, drop a live in the comments. If you're catching this on the replay, drop replay in the comments. And, I'm really kind of looking forward to hearing what y'all have to say. So let's get into it. So today, what it is that I want to talk about is diabetes. Diabetes. And one of the reasons I want to talk about that is that I deal with it. I am a type 2 diabetic, and I haven't been a diabetic all my life due to some, I guess you could say, poor choices and bad habits. I found myself to be a type 2 diabetic, and this has led to all kinds of things that have had to change in my life. In fact, at one point, the situation was so bad that I was killing myself. Literally, I was running real fast toward killing myself. And, it was a really bad situation. And, thankfully, I've got it turned around to where, my diabetes is now being effectively managed. The next step is to work on getting it so well managed with diet and everything else that I'm going to talk about here, that I can get off some of the medications that I've had to be on. For those of you who are not aware, my A1C a little over a year ago, which is a measure of it's a long-term snapshot of where your blood sugar level is. Like you can use a glucometer, like this one that I have here, and you can check where your blood sugar is at that moment. But for your overall health, it's important to have an idea of, is it trending high? Is it trending low? Where should it be? That kind of thing. Now, where should it be? Well, if you're not a diabetic, your A1C should be under 7. If you're a pre-diabetic, you're going to be between 6.5 and 7.5, I think, if I'm remembering correctly. And the higher your A1C gets, the more damage you are doing to your body, because that means that there is sugar in your bloodstream that is not getting processed. It is not getting used, and this is causing all kinds of damage. Now, my A1C was over 14 a year and a half, a little over a year ago, and in 1 year, making some very simple health decisions and starting a regimen, a daily thing that I was doing, which included making sure I was getting enough fiber, because believe it or not, dietary fiber is a big aspect of helping to control blood sugar. I was able to get my A1C down to a 7.1, which is huge. And I went from my primary care manager wanting to see me, the doctor wanted to see me like every 3 to 6 months, because my blood work was so out of whack and my diabetes was so high that she was really, really worried, and lots of things had to happen to try to get this taken care of. So let's get into it. So today we're talking about diabetes. So let's go ahead and talk about it. So, first of all, what is diabetes? Well, diabetes is a chronic health condition that affects how your body turns food into energy. And also, there isn't a cure yet for diabetes. And one of the big things about that is that your body takes food and it breaks down into, like carbohydrates, different kinds of things get broken down into a type of sugar in your bloodstream called glucose. And that glucose needs to get into your cells for your cells to use it. And what your body secretes to facilitate this is called insulin. Now, if you're somebody who is a diabetic, a type 2 diabetic, that means your body isn't doing enough insulin, or maybe your cells are resistant to the insulin. There's a couple of different ways that can play out. Now there's three types of diabetes that we talk about. The first one is type 1 diabetes, and that's when you're insulin dependent. This is thought to be caused by an autoimmune reaction in the body that's causing that problems with insulin production and that kind of thing. This is something that's usually diagnosed in children, teens, and young adults. Um, if you're a type 1 diabetic, usually you're going to have it figured out before you get to an adult. Otherwise, you're not going to live that long. Yeah, I think. And the thing is this is somebody who has to take insulin every day. Their body doesn't make enough of it, so they have to check their blood sugar. If their blood sugar's high, they got to take insulin. They got to make sure they don't do too much insulin, because you don't want your blood sugar going so low that you end up having problems from that. So it can be kind of a tricky situation. You got to manage it. You got to be monitoring it. It's very, very critical, and it can kill you quickly. The type 2 diabetic, which is what I am, that is somebody who is not insulin dependent, but their body doesn't use it well, and it doesn't keep the blood sugar at normal levels. About 90 to 95% of the people who have diabetes have type 2. Now, this can be prevented or delayed with healthy lifestyle and changes in that kind of thing. The other type of diabetes that you normally will hear about is gestational diabetes. And this is for women who are pregnant. Guys, you can't claim gestational diabetes. Sorry. It's not a sympathy thing. You may be gaining sympathy pounds, but this is no. Gestational diabetes develops in pregnant women who've never had diabetes before. The baby can be at increased risk for health problems. It also increases the mother's risk for type 2 diabetes later in life. And another thing about this is that this puts the baby into a situation where they're more likely to develop obesity as a child or teen, and possibly even type 2 diabetes later in life. Now, there's kind of a fourth category in this discussion with diabetes, and that's pre-diabetes. And what that is when your blood sugar's running kind of high, and but they're not high enough yet that you be considered being type 2 diabetic. Now, in the US, it affects about 96 million adults. It's more than 1 in 3. So grab 3 people, odds are one of them is pre-diabetic, if not diabetic. And here's the really, really dangerous part. 8 in 10 of them will not know they have it. So think about that. 80% of the people who are pre-diabetic, on average, do not know that they are pre-diabetic. And if you don't know, you might not be, well, you're not going to be aware that you need to make changes and the things that you're going to have to do for that. Sorry, folks. I had a little trouble trying to fall asleep last night, and I rode this morning, so my blood sugar is actually probably a little low right now. I checked it about 15, 20 minutes ago. I was at about 120, and that's pretty good for, post meal. Post meal, you want your blood sugar to be under 140. So 120 is pretty good. Now I'll tell you, I used to check my blood sugars and I'd be like just horrified and embarrassed because I didn't want to tell my wife, who's a nurse, because my blood sugar was well over that 140 mark. So the big thing with pre-diabetes is that it increases your risk for type 2 diabetes. It also increases your risk for heart disease and stroke. Now let's talk about some of the risk factors real quick. For type 1 diabetes, the main risk factors are family history. If you've got a parent or a sibling that has type 1 diabetes, there's a good chance you might end up with it. Age. You can get type 2 diabetes at any age, but it's more likely to develop when you're a child, teen, or a young adult. Now, risk factors for type 2 diabetes. Having pre-diabetes, like we mentioned. If you're overweight, if you're over the age of 45, if you have parents, siblings, a family, basically you have a family history of type 2 diabetes, that's a risk factor. And if you're somebody who finds themselves physically active less than 3 times a week, that's also a big risk factor. Now, physical activity doesn't have to be, massive. We're not talking you have to go out there and, be crushing it, doing the CrossFit and that kind of thing. But, getting up and walking around for 15 to 20 minutes, doing that 3 to 4 times a week will significantly lower that risk for you. The risks for gestational diabetes, having had it before during a previous pregnancy, if you've given birth to a baby who weighed more than 9 pounds, if you are overweight, if you're more than 25 years old, if you have a family history of type 2 diabetes, or you have a hormone disorder called polycystic ovarian syndrome. Now, if you have any of these, you are at risk for gestational diabetes, and I hope you're getting the kind of pre-care that you should be getting with a pregnancy. And these things are being discussed with your doctor. Now, the risk factors for pre-diabetes: overweight, over 45, have a family history of type 2 diabetes, physically active less than 3 times a week. If you're a woman who's ever had gestational diabetes, you're at risk for pre-diabetes. And here's the other thing that for type 2 diabetes, for gestational diabetes, and for pre-diabetes, if you are African American, Hispanic, American Indian, Native Alaskan, some of the Pacific Islanders and Asian Americans, these groups tend to have a higher rate of diabetes in their population. So that's something else to keep in mind. Now, the symptoms that you'll find, this could be things that could kind of tip you off that you might need to get this checking out. You feel like you're peeing all the time. And dark colored. You're thirsty all the time. You're very hungry. Your vision feels blurry. You have tingling sensations in your hands and your feet, or you're losing sensation in your hands or feet. You're always tired. You have very dry skin. If you have sores, they don't heal very quickly, and you're more prone to infections. So those are some of the things, that are symptoms for that. Now, what can you do? Now, like we said, now there is no cure for diabetes yet. But what can you do? Well, simple things. And some of these are what I'm working on right now. Losing weight. So far in the last, I want to say 2.5 weeks, I've lost over 10 pounds. So that's a good start. Doesn't mean I'm anywhere near finished. Changing to healthier eating habits. Now, this is part of the reason I'm doing the R3 program right now. It's changing my relationship with food, because I'm not going to give up delicious. I'm not going to give up delicious food. Now, do I need to change how often I have some of it? Oh, absolutely. And do I need to find ways to have delicious food that's healthier for me? Yes. And that's part of what I'm working on and learning about. Another thing that you need to do is monitor your blood sugar levels. I need to get better at doing that. Of course, and then, increasing your level and frequency of physical activity. I am trying to row 4 days a week on my rowing machine. So that's what I'm doing. If you are prescribed medications by a doctor for your diabetes, take your medications. If you feel that you've gotten to the point where you don't need to take them, talk to your physician before you just stop taking them. All right. It's very important. Now, and another thing is like I've had to do, learn about self-management, get education for diabetes self-management, and find support systems out there. And if you have appointments to follow up on things with your physician for your diabetes, then, by all means, make sure that you follow up with those appointments and keep those appointments. So that's pretty much what I wanted to talk about. If you guys have, had any issues with diabetes, feel free to reach out to me. I can share with you some of the strategies that I've used. Not saying everything will work for you, and I'm not saying that there's one solution for everyone, but simple things like changing how you eat, changing the kind of food that you have in your diet, and then also working on making sure that you're doing getting the right kind of things into your healthy habits, and then working on those healthy habits. It can be done. It takes effort, it takes work. If you need some pointers, reach out to me. I am not a physician, I am not a nutritionist, but I will share with you the things that I have done that have made a difference for me. And I will always encourage you to seek the help, seek knowledge from your healthcare professionals before just taking anything at face value or for granted. And of course, you can always check out the American Diabetes Association on their websites and the Center for Disease Control. They also have good information there for those of us that are dealing with diabetes. So now, if you're watching this on Facebook, folks, I'd really appreciate it if you'd like the video and click follow so that way you can know when I'm going to be going live again. And then if you're watching this on YouTube, please, by all means, click like, hit subscribe. Really want to see, what you guys are interested in, that kind of thing. And liking and subscribing is telling me what's going on. So in the meantime, folks, peace, love, and photography. And remember, everything can make a beautiful image, including you. Have a great afternoon. Bye.